Okay guys, so now we are going to actually talk about Cath. So we're going to access Chester's Cath. And how do you know there's a Cath? One, it's in the chart. Two, you can actually visibly see something raised in their skin. So it's either on the right side or on the left side. Most of the time I've seen it more on the right side. But you are actually able to see the raised port through the skin, and you're able to palpate it. Okay, and just a quick tip: when you're going to access, you want to make sure you're using your thumb and then your middle finger to hold it as you're going to access. The other thing too is, how do you know that you have a regular Cath versus a power Cath? On the power Cath, when you're palpating the top of the port, you're going to see like 3 ridges at the edges, and it's very noticeable, so you'll be able to tell that there's a difference. And what's the difference? You will need heparin at the end. So for now, we found our Cath, and then we're going to access the Cath because we're going to draw blood as well. So the first thing is, I'm going to hand sanitize my hands. I'm going to don my mask, and then we're also going to ask the patient to put on a mask as well, and then turn away from the site. The other thing we need too is our Cath access kit, and then this we can get from Center Supply. It actually has everything there that you will need. It also comes with a flush too on the back as well, so it makes it easy. So then we would pull this out from here, open it, and then right when you open it, you are going to see that there is a mask here and gloves. So we don the mask, and then we would also give a mask to our patient as well. And then we would don our sterile gloves, and then we would use these gloves in case we had to change the dressing, then we would do that. The other thing, once we open the kit, it comes with the needle that we're going to need, and then it comes with a drape that we will use. In this case, if the patient had his t-shirt on, then we would just kind of slip it right on the t-shirt, so it could be like this, in this motion where the port is. Okay. And it also comes with ChloraPrep, gloves, dressing, gauze in case we needed, extra strips, alcohol pad, and then again skin protectant prep pad for the skin as well. So the first thing is, we're going to make sure that we have our needle access. Okay, so the first thing is, we're going to prepare our needle. We're going to make sure that it's primed, capped, ready to go, so that once you access, you'll have your saline attached to it, and you'll be able to draw the blood for whatever you may need. So we'll open the kit. So when you take off the needle, you'll see that the needle is right there. You will make sure that everything is nicely primed. So we would connect our saline flush to the cap. And then we're going to access the cap here. Take this part out. We'll be able to flush, and then we're going to gently see the saline drip. Okay, So then that means that we're ready. So when we're ready, we're just going to remove the plastic covering and we're going to go there. So we still have our sterile feel. So I'm going to go ahead and don my gloves after I've done the hand sanitizing my hands. I'm going to start with the right hand because I am right-handed. Okay, so I'm going to use my left hand because I'm right-handed. So I'm going to use my left hand, and then as I mentioned, I'm going to use my thumb and then my middle finger to hold it. So I am holding it here, and I can feel it here. So I'm going to use the chlorhexidine, and as I mentioned, if the patient's allergic, you do the betadine and the alcohol first, and then the betadine. And so then we would clean the area, again, at least 30 seconds, and you want to make sure that it's clean. As you're cleaning, you want to start inspecting the area. You want to make sure if there's any hematoma, is there any irritation, anything that looks abnormal to you. You want to also make sure with the patient, hey, Mr. Chester, do you guys usually have trouble accessing your portacath? Is it easy to draw blood? Just gives you an idea on the potential challenge you may face when you're entering the needle. Now once we're ready, and we're holding it right in the middle, now we're going to just sort of rest my finger on the chest here, and then I'm going to go in a 90-degree angle, and I'm going to go right straight, and then I'm going to go once I find resistance. That's usually the end part of the port. Once you've done that, I'm going to flush it, and then I'm going to pull back, and then I'm going to be able to see blood. Once I see blood, that means that I'm in. So once you apply we'll just put the dressing, change over. So now it's time to deaccess the portacath. I have my flush, I have my heparin, and then I have my Band-Aid. In this case is a power port, so we're going to instill 500 units of heparin per the doctor's orders. So we're going to flush, and I'm doing the pulsating method. I'll put my heparin in. Okay. Clamp. And now I'm ready to peel off the dressing. So to deaccess, I'm going to use my non-dominant hand. I'm going to use my finger and my thumb to hold the bottom. And then this part over here, I'm actually going to pull up, and it's going to lock. Okay, here we go. 1, 2, and 3. Up, we pull. So the needle has retracted back. And now I am able to remove and make sure that I don't have a risk of sticking myself with the needle. Once we're done, this goes to the sharps container, and then we would just apply the Band-Aid. If you guys have any questions, make sure that you refer to the policy, to Lippincott, and also ask your charge nurses as resources. Okay?